Good evening, everyone. Thank you for joining us for Pulse on the Vaccine. My name is Kim Bender, and I'm the Executive Director of the Healthcare Foundation, Northern Sonoma County. Founded 20 years ago in 2001, our vision is to eliminate health inequities in our region. We connect people and resources to promote health and wellness to underserved communities. Tonight, we've asked 5 local medical professionals and community advocates to join us in conversation on the status of the COVID-19 vaccine in Sonoma County and who, where, when, and how to get vaccinated if you're a Northern Sonoma County resident. We also want to explore vaccine hesitation, vaccine anxiety, which is the opposite. They're like, when can I get my vaccine? And the important topic of health equity. I'm going to give you a brief rundown of what we're going to do tonight, and then we'll jump right in. We're going to give short bios on all of the speakers. We're going to do a quick poll to find out whether you have been vaccinated. What is your vaccine status and how do you feel about it? We're going to then share some community briefing slides that came out yesterday from the county that will provide a nice overview for what context for this conversation. Then I'll ask each panelist to state an overarching message or brief story that they'd like to share with us. I will moderate a conversation for until about 7, then we'll move to audience Q&A. Please type your questions, if you will, in the Q&A function. We were not using the chat function tonight, although we will send out a couple of links through the chat function. My colleagues will put those questions in front of me. Please use your name and your location, what town you're from. And we may not get to all of them, but we'll do our best. We do plan to end promptly at 7:30 so that you and our guests who are working tirelessly on the front lines of this vaccine effort can get some rest. All right, so I'm going to give brief intros. For fuller bios, please see the bios on our website at healthcarefoundation.net. First, we will hear from Dr. Kendall Hammond, who's a practicing endocrinologist at Kaiser Permanente in Santa Rosa, and is currently the Assistant Physician in Chief of Care Experience and Outpatient Quality. Then we will hear from Dr. Jennifer Fish, who's a faculty member at the Sutter Santa Rosa Family Medical Residency Program and a family physician at Santa Rosa Community Health. She's also the co-founder of the local health professional activism group, HPeace. Susanna Labby is the medical director of Alliance Medical Centers in Healdsburg and Windsor. She's passionate about working with the medically underserved and committed to improving access to quality healthcare for all residents in Sonoma County. Shalene Lopez is the coordinator of health promotion at Providence, formerly St. Joseph's Health. She works to educate people on heart disease, COVID prevention, and the COVID vaccine, with a focus on the underserved and farm workers. Dr. Michael Valdovinos is a board-certified clinical and organizational psychologist. He hosts a weekly health-focused Spanish radio show on 89.1 KBBF, and Dr. Valdovinos joined the Healthcare Foundation Board of Directors in January of this year. So we're going to do a quick poll right now. I'm going to ask you to see if I can launch this poll. Here we go. I'm going to ask you a few questions about your own vaccine status. And while you're answering the questions, I just want to say that a year ago, I started at the Healthcare Foundation in March of 2020 or 2020. In May, we thought we were opening up. And as you remember, we started, the lockdown ended, and we were really looking at what did that mean to open back up. So that was the last panel discussion. Well, as we all know, things went a little differently. We opened up and went into some other territories that were previously unknown to us. So today, we are exploring where we are right now with this, with the stage of the virus. All of us are experiencing tremendous pandemic exhaustion, and are also excited to get the vaccine. The message from COVID-19 vaccine chief for Sonoma County, Dr. Urmila Shende this week, she was unable to attend tonight, but she wanted us to hear the message that there's a vaccine shortage. We know that it's been a real complicated process, but please be patient, wait your turn, things are ramping up. That's from Dr. Shende. All right, so let's see if we can share the poll results. Let's see what we got. Only a couple people have been vaccinated. Most people say it's not their turn yet. If they plan to be vaccinated, they're going to their healthcare providers, looks like. And some people are going to, let's see, can we see the rest of the slides? Local clinics, 11%. Great, that's really helpful for our panelists. Thank you so much. All right, so now I'd like to share a couple of slides that the county sent out, and then we will get on with it. All right, so can you all see my screen yet? Not yet. Here we go. Is that visible to you now? Great. So first, let me go to this slide. The number of people who've been vaccinated in Sonoma County right now is 74,000, or number of doses that have been administered is 74,426 as of yesterday. 47,000 have had first doses, 13,000 have had 2. So that is the status. I'm sharing the screen. It's a little difficult to read, but I wanted to share the doses administered by provider because I found it really interesting. The top line, which you may not be able to read, is the Kaiser numbers. So Kaiser has been by far the provider who's administered the most vaccines, looks like around 16,000. The yellow line is the number of people who've had a second dose, and the green line is the number of people who've had first doses. Sutter is the third line down. CVS is this line here where my cursor is. Safeway comes after that. St. Joseph's is here. Santa Rosa Community Health, Alliance Medical Center, Petaluma Health Center, Healdsburg Physicians Group are all here in the middle, and Alexander Valley. So I thought that was a really interesting slide for us to look at. 15% of Sonoma County residents age 16 and above have received at least 1 dose. That's a pretty good rate based on other counties in the state. We are at 15.39% compared to these other counties. And here's a breakdown by race and ethnicity as of yesterday. We can see that 11% of the vaccines that were administered were Hispanic and Latino residents, 64% to white residents, and so forth. And then you can see the percentage of the population related to that. And lastly, I thought this was interesting, proportion of each age group that's been vaccinated. So the top line is 75 and older. 45% of the Sonoma County residents have been vaccinated so far. And then so on and so forth by age, as you can see. So that kind of sets the stage. And now I thought we would turn to our guests. So let's start with Dr. Hammond. Can you please give us just the message you'd like to share to open our conversation?
Sure. Thank you, Kim. And thank you to the Healthcare Foundation for allowing me to participate. I think the most effective thing I can do is just provide an overview of what's happening at Kaiser Permanente. In Northern California, we've given over 250,000 doses. And we know that we take care of 25% of the population in Northern California. But unfortunately, we've received only a small fraction of that proportional allocation, considering all of the vaccine in the state right now. We in Santa Rosa, I think you already shared this data, we've given over 14,000 shots in arms so far. And one thing I want to make very clear is that we are using every single dose that we have, and we are doing it very swiftly and efficiently. And we know it's not as much as we would like to have to offer our community. And I feel for our patients in our community who are really impatient and eager to get this vaccine. And what I will say is, I am so glad that you want to be vaccinated. And I think, the limitations in our supply is really up till now, why we've only been able to focus on those members 75 and older and healthcare workers. We just have not received enough dose to open up more tiers. But I'm also very optimistic, and I'm optimistic because there is going to be more vaccine. And when there is more vaccine, we're ready, and we're ready to increase our availability for vaccine substantially. So I'll leave it there.
Thank you so much, Dr. Hammond. Dr. Fish.
Yes, thank you. Good evening. Again, thanks for the opportunity to come here and be with everyone tonight. As a local family physician and community activist, I think there's a couple messages that I'm planning and hoping to share this evening. The first one is that we all just need to take a deep breath, right? This is really stressful for everyone. There will be vaccines. I agree with Dr. Hammond, like it will come, your turn will come. But because of vaccine scarcity, if we want to have an equitable approach, we have to slow everything down and we have to look at how we're doing that. And my biggest concern is that when we're utilizing existing health institutions and in existing structures that have inherent inequity already built into them, we're just reinforcing inequity, which is why the county's decision to not just purely do age-based risk prioritization, but to really follow the tiers of including essential workers, caregivers, et cetera. That is where the equity comes in. And we have to prioritize that, right? There are plenty of people that are able to mitigate their risks, work from home, stay home, get groceries. And we have a huge proportion of our population that does not have that privilege. And they carry significantly more risk because they are helping keep our society afloat. There are essential workers that suffer significant financial, housing, food insecurity that gives them no choice but to go out and take that risk, right? And so my big takeaway is that if you're able to mitigate your risk, wait your turn, right? Don't use the loopholes, don't work the system, and just know that it will come. And right now we're just trying to really prioritize those at highest risk. That's what I have to start with.
Dr. Fish. Sue.
Sure. Well, I'll echo the other speakers in thanking you for the opportunity to join tonight. And, as you mentioned in my bio, I'm very passionate about the need to bring equitable access to quality healthcare to under-resourced and marginalized communities. And there's never been a more important time to ensure that that happens. So in wanting to kind of add on to what Dr. Fish was saying, the equitable distribution of vaccine is just so important at this time. I spent the day, all day today, giving vaccines to agricultural workers in Sonoma County. We delivered 580 doses. And I can tell you the relief and the joy on the faces of the individuals finally seeing a light at the end of this tunnel was so rewarding, and probably one of the most rewarding things I've done in a really long time. We serve the working poor. We serve people that don't have the ability to stay home and be protected, and their families have been devastated economically. They have lost loved ones. We've had, families where 22 people were infected with COVID, and the devastation that brought from an economic standpoint and from just a loss of community and loss of support has been heartbreaking. And so to finally be a part of bringing that same community hope is an amazing experience. But I also, want to echo what Dr. Fish said, that these folks don't have the privilege or the ability to stay home and stay safe. They have to put food on their table. They have to work. They have to expose themselves. And so we need to make sure as we roll out this vaccine that we're not in such a hurry to get it out that we marginalize those that have been already so disproportionately affected by this horrible pandemic. And so I think especially as FQHCs and knowing that our role in healthcare is to fight for health equity, we really need to make sure that we're advocating for that every step of the way. And that's why I'm really glad that we've been brought to the table to be able to be big players in the distribution of vaccine, because I know that all of us will do what we can to make sure that that happens. And I hope that we can get the community support around that.
Thank you, Sue. Shalene?
I also want to thank the Healthcare Foundation for inviting me. I'm really happy to be here. COVID has been very, very personal for me. A good friend of mine about a month ago passed away from COVID. She was an essential worker. She worked at a winery and she wasn't within the 75 or older range. She was my age. And to me, it is very hard to not have our workers that are putting the wine and the food on our table not able to get the vaccine. It really bothers me. But I agree with Dr. Fish and with Sue about we need to do this, take a deep breath, slow down, and really think about your risk and where, if you can stay at home, work from home, let someone else go ahead of you, please. It really would make a big difference. This family is devastated. The mom was the heart of that household and she's gone at this point. And the whole family has been affected. So thank you for your time. I'm really happy to be here and I'm looking forward to answering any more questions.
Thank you, Shalene. Dr. Valdovinos.
Yeah, well, thank you, Kim, and thank you to the Healthcare Foundation for supporting this. I think it's such an important and timely panel discussion. And, you know, I think my message, I could very well just say ditto to what everyone else has said, but I would sort of just add on that I really want to give voice to all the different people in the community who have been lending their efforts in a push to get out education, to help other people in the community, to, you know, borrow everything from, you know, microwaves to refrigerators, to donating food, to, I mean, the community, the way in which I've seen has really stepped up and helped one another out. You know, there's been cross-organizational support. Relationships have been formed and have flourished through this whole period. And I've gotten to know so many different wonderful people in the community who have just stepped up, and I don't think they get enough credit for what they do. And so, you know, I just want to send a thank you to everybody who's continuing to push above and beyond to continue to support our vulnerable communities, to continue to support each other, and help you know, everyone through what could very well be one of the hardest periods of all of our lives. And you know, I hope that those folks who are listening in on this panel can be inspired, if you're not already doing so, to continue to find ways to empower and support those folks who are involved, or yourselves if you want to get involved. There's lots of opportunities to help not just vulnerable communities, but a lot of other organizations and communities that are trying to really push hard during these really trying times. So thank you to everybody. Thank you to these panelists, and thank you to anyone who's listening and who's doing a lot of hard work that, you know, you don't get the recognition that you deserve, but I don't want that. I don't want to take that for granted. And I certainly don't. So thanks.
Thank you, Dr. Valdovinos. Well, we have a lot of questions, some that our own staff has generated and some from all of you out there. But what I'd like to do is just ask, there's a couple of categories that are emerging, and that includes vaccine logistics, health equity, vaccine hesitancy, and what I'm calling vaccine anxiety around people who are very anxious to get the vaccine and want to know where they stand with that. So we got to see some interesting data to put in place, you know, sort of see where we are with our efforts. And I think it's a little, when I saw it, I felt like it's a little bit better. What is the best way for someone to find out where to get the vaccine? Does anyone have an answer to that? I think we can chat out the link to the Sonoma County resource page where there's about 30 different options. So I think that question we can just go ahead and chat out. Does anyone want to answer that question? I think if you're a Kaiser patient, yeah, go ahead,
Sure, I can start. So we are prioritizing our patients who are most vulnerable in terms of increased risk for mortality or death from COVID, or complications from COVID, as well as those who reside in vulnerable neighborhoods or communities. And so we're able to prioritize those patients. And currently we are doing proactive outreach when it's your turn for vaccination based on the state criteria and then those internal stratification that we're able to do. So once a member is contacted by Kaiser Permanente, then they can schedule their appointments online or by calling our appointment and advice line. And then, of course, we keep our kp.org / COVID vaccine website updated.
Great. So I'm going to go ahead. There's so many questions. I think we'll just go ahead and we'll bounce around. Does anyone else have a response to that question about where to get your vaccine? Jenny, you want to answer?
I mean, I think Shalene was probably going to say something similar. I mean, going to the socoemergency.org/vaccine site kind of can walk you through it. If you're associated with a particular practice or institution, my recommendation is to stick with that practice or institution. So Kaiser patients are going to be served by Kaiser, Sutter patients, again, by Sutter. There's some gray areas and some overlap, but, and the FQHCs are doing tons of work as well, and so, my recommendation would be to stick with your systems. They can risk stratify you, they can serve your needs better, they have your medical history, and then that could potentially leave the county sites, right, more for folks that actually need it. They're not attached to healthcare systems. They don't know how to navigate that, whatever it is. Again, the inequity comes when we're allowing or kind of depending on existing health systems to roll out the vaccinations. If you're not associated with those systems, then inevitably you're left behind. If you don't have connections within those systems, inevitably you're left behind. And that's what we're trying to fill the gaps with the county sites and with the FQHC sites. So that would just be my general recommendation. As we can see, Kaiser's done the most, right? Kaiser, Sutter, St. Joseph's, they get their own supplies from the state. It's not connected to the county, right? They're getting those supplies and it's independent. And so the county efforts are really trying to focus on that equity piece.
I'd like to hear from Sue about the role of the FQHCs in this ecosystem.
I mean, so a lot of what we do is kind of, we're the safety net, right, for the community. And so we're catching those folks that don't have those connections, that don't have, they're sometimes I know for one of the first events we did, a lot of the elders that got vaccinated went to private physicians who weren't connected to some of these large, I mean, of course we vaccinated our patients, but the private physicians here in Hillsburg that weren't connected with the St. Joe's or the Sutters or the Kaisers and didn't have access to the vaccine and reached out to us and said, these patients are very vulnerable. We know our patients, we know, their comorbidities. We're worried about them. They don't have transportation outside of Healdsburg. They can't get to these other sites. Can you help us? And so we are the safety net for our neighbors. And so we were able to kind of bring those folks in and make sure that they had access to the vaccine and that they weren't left behind as the larger systems were able to kind of roll out their vaccine program, and that our local neighbors, even those who weren't our patients that were most vulnerable, had access to the vaccine as well.
Thanks, Sue. What about Shalene? Did you want to say something? Okay.
Covered it.
Sticking with vaccine logistics for a minute, can anyone answer this? How are essential workers to find now? Because there was a definition during the pandemic, but now with vaccine rollout, there's a different definition and different tiering. Can anyone speak to that? Jenny, Kendall, or Sue?
I can jump in. So it's actually clearly, when the county puts it out and defines it pretty clearly. And so in terms of the essential workers, they're really focusing on food and ag. And it's not like, they're not yet to the distribution point of like people that are working in grocery stores, for example, although that's, or in restaurants, that's going to be down the line. But it's really the people kind of at the beginning of that chain. So that are working in agriculture, that are working on wineries and dairies, et cetera. And that's that piece of the focus. And now they're expanding it to school educators, childcare folks, and then they'll kind of move down on that. And so it's kind of changing every week. They're expanding it bit by bit, but it's clearly defined on the county's website.
Thank you.
One thing I'd like to add is that was determined based on science, right? This isn't just a random thing that they've decided to take these categories. These are the areas where we're seeing the greatest prevalence. So there's been huge outbreaks in food manufacturing and in agricultural groups. And so, you know, a lot of the folks that we're vaccinating right now live in dormitory style congregate housing. We know that those folks are at huge risk for large outbreaks. And so the reason that these essential workers were identified as being those to be the first eligibles because they're at the greatest risk. So it just, people need to understand that it's not random. There's really science behind these decisions and why we're rolling it out the way that we are.
And then the one thing I would just add to that is UCSF just came out with a study where they were looking at essential workers between 18 and 65. So everybody below the 65 age cutoff, and really stratified it based on increased risk of death. So it's not just increased risk of infections, but actually increased risk of death in food and agriculture. And again, so it's based on science that they're making these classifications.
Thank you. I want to switch over to the topic of health equity, about vaccine hesitancy. And Dr. Valdovinos, can you speak to that a little bit? And I'm sure Shalene, you could too, about what you're seeing out there, and is it shifting? Because we know that from early studies from the fall, quite a number of people were really hesitant in the Latinx community. Can you give us a bit of an update on that?
Sure, I'm happy to tackle that, and I'm sure Shalene has her own experience of this. And I would give you a sort of a multi-tiered response to this, and I think it's a function of at least some of these pieces, but likely more, with some good news as you're sort of referencing, Kim. And I think first, which has been already brought up, you know, from a number of different folks already, is that, you know, we have a long-standing healthcare systems problem that favors those that have access and privilege. I mean, that's super clear, and we're seeing some of that now, or quite a bit of that now. And so one has to know how to learn and navigate this system, and, you know, to really benefit from American healthcare, you know, and from what American healthcare has to offer, we have to know how to navigate and be able to learn and have knowledge of how to navigate the system. And what we know is that many underserved communities and people who of color just don't have that and don't have access to that. So that has led to some of the issues around hesitancy with regards to vaccination. I think another thing that has impacted you know, this hesitancy is that, you know, the political landscape for the last 4 years has really created separation and fear between healthcare and our vulnerable communities and people of color. And that extends into the acceptance of a vaccine, right? The idea that this grew out of a very volatile political system, and that has had ramifications on how people think about the vaccine, think about the vaccine in the context of how it's impacting people of color. And, you know, we've heard, and Shalene has heard this too, we've heard in the community over and over these sort of really dark ideas around why the vaccine was even developed, what it is, and how it affects people of color, how it affects different people that aren't, you know, that are white. And so you start to see, whether, irrespective of whether it's true or not, you start to see how some of these ideas manifest themselves. And then I say, lastly, you know, one thing that I think hasn't really helped all that much is social media. And, you know, you have these ideas that spread online, and they develop and spread in these deep pockets of social media. And unfortunately, I would say fortunately and unfortunately, but in this context, unfortunately, these ideas spread much faster than we have an ability to sort of play whack-a-mole to, right? People end up coming up with these ideas, they spread in groups, they are connected to our emails, our messaging systems, on Facebook links and Facebook posts, and they become the dominant part of the conversation. So then to extinguish that is really, really challenging. The good news, I would say, though, is that this interesting thing called group dynamics sets in really quickly when people who work in teams and groups start behaving in certain ways. We're doing it all now, as a manifestation of how we each are responding to how we're acting and behaving, and that sets in within teams and in groups. And so our hope is that a certain followership is going to set in when people, especially leaders within groups, whether they be healthcare workers or whether they be ag workers or working, in teams out in a vineyard, some of those leaders step up or other people in the group step up to get vaccinated. Our hope is that there'll be a certain followership that follows and other people will start to get vaccinated, which I think is already happening. So a little bit of good news and some ideas as to why there's some of that hesitancy there.
Thank you, Dr. Valdominos. I'd like to turn to Dr. Hammond for a second. What is happening within the healthcare system at Kaiser? We've heard of some stats on healthcare workers being hesitant, and want to hear the update on that from your standpoint.
Well, I would say that our experience has been quite encouraging, and we've vaccinated over 87% of our healthcare workers internally within Kaiser, as well as many healthcare workers who work outside of Kaiser and or who are non-members. So we've participated in that very early on in the vaccination rollout. And so I find those numbers encouraging. And of course, we'd like that number for our entire community to be more like 90%, and know that the faster we can vaccinate our community, the slower this virus is going to mutate or change. And that's a really good thing. But most importantly, we want to get back to our normal lives. We want our kids back in school. We want to open up our businesses and our communities. We want to get back to the things we love to do and the people we love to spend our time with. If I may, just along the lines of vaccine hesitancy, make one more point, and that is about the concern about how fast the vaccine came to fruition. The reason for that is that there was really a lot of foresight on many levels to make sure that we could get this vaccine very quickly. Normally, when new vaccines come out, they go through phase 1, phase 2, phase 3 trials, and they do so in sequence. And in this case, these trials and these different phases of understanding vaccine efficacy and safety happened simultaneously. So they happened very quickly, but it's not like steps were skipped along the way. In addition to that, the planning for vaccine mass distribution started at the get-go. So in other areas in medicine, we have something new, we test it, and then we start increasing our supply and thinking about distribution. And we really did, as a scientific community, get to a place where we are confident as scientists that this is both safe and effective.
Thank you.
Kim, can I piggyback on that just real quick? Yeah, I just wanted to sort of share that, one thing that we don't give enough credit to is really also the business owners in these organizations that are, rallying and incentivizing and celebrating their employees to get vaccinated. So a lot of these, bigger organizations who employ, for instance, farm labor and ag workers have really done a good job at trying to empower their employees and really celebrating that they're getting vaccinated. And we're seeing the end result of that too, which is really encouraging.
Great. Shalene, can you tell us a little bit about the vaccine education among farm workers that seems to be working?
Yeah, so it may be as basic as talking about vaccines. What is a vaccine? Because sometimes they don't realize even what is a vaccine and what it's used for. I start out very, very simple out in the community, just talking about, oh, what is a vaccine and why is it used? Like we don't have smallpox anymore in the United States because of vaccine and what the use is for it. And so it's very, very basic information, and just listening to why they may be afraid. It's very, and recognizing, yeah, it's okay to be afraid, but let's talk about it and let's figure out how you can, you know, dispel some of the myths. Because today I was out at a ranch and they were telling me, oh yeah, we're being told that we can't drink for 40 days after the vaccine. And I was like, I don't think that isn't true. You know, so it's just listening to them, answering their questions. And I was really surprised at the group today. Was about maybe 10% wanted the vaccine after there were more than 50%, because they had the conversation. The problem is that we haven't had those conversations. We haven't had the time to really get out and really talk about it. The press and all the media and Facebook and all of that has been doing the negative, and we really haven't taken the time, and people haven't gotten, you know, there isn't enough of us to get out in those fields and talk to people. And we're working on it, but it's taken time, you know.
Thank you. I know you're doing that, as are you, Michael, and others. Thank you so much for doing that work. I'm going to turn to, and unless anyone else has something important to say about that topic, I'd like to turn to, yeah, go ahead. Go ahead, Jenny.
Let me just add just really quick to that, is that Shalene and I, a couple other people, are part of like a subgroup on vaccine communications that was put together through CHI, or the Committee for Healthcare Improvement. A lot of the work we're doing, and it's cross organizations, it's collaboration, it's coming together, it's strategizing. And then, so there's that group, and then there's LEAP solutions through the county. And then, I mean, each institution is doing their own thing, and everything is siloed. And like the coordination, there's a lot of meetings, but the actual like on the ground work that Shalene and Mike are doing, and that we're trying to do with community organizations, that's where the magic is, but that's not where the systems are, right? And so we have to figure out how to flip the way we normally do things and prioritize the on the ground community outreach, as opposed to just like spinning and talking and like not actually making it happen. And so there's really powerful things that are coming from the community. And if you empower the community to do the messaging, tell their stories, do the outreach, that's how we can actually make a difference, right? And there are movements to do that. And I just want to speak to the power of actually empowering the vulnerable communities themselves to bring us in and to kind of work with us and share that messaging.
Thank you so much. And I know that Alliance is doing tons of outreach to talk about the importance of the vaccine, very targeted bilingual, bicultural outreach to your patients and others in that community. So I know you're all working on that. We have a lot of questions. Are we ready to turn to some of those from the audience? Let's see. This is to Dr. Hammond at Kaiser. Audience member Vicky Farrow says, I know you don't feel you have enough vaccine, but you've clearly done the best of anyone. Does that mean you're getting more than your share, or are others not executing as well? And Jennifer, are you seeing people use loopholes? So Dr. Hammond first, please.
So I will say that, you know, what our fair share is really hard to commit to, and there's just a shortage. And so going back to Dr. Shende's statement that you read earlier, there is a shortage of supply. More is coming, and we all need to be patient and take a deep breath. I thank you for the compliment to our systems. We have really good systems, so we know how to do this, and we know how to do it efficiently. We will continue to do that just as fast and as soon as we get supply. and we will continue to partner with our partners in the community. You know, this is not our first go at a community-wide crisis. And one of the things that I've personally enjoyed so much about leading this work is the opportunity to collaborate with our county partners, to think creatively together, to come to solutions together and share strategies and best practices. So I'm confident we can continue to do that as a community.
Thank you. While I have you right now on that subject, Carol Beatty from Healdsburg asks you again, Dr. Hammond, I'm a member of the patient advisor on your team for care experience and patient quality. How might Alliance Medical Clinic and Kaiser collaborate during this time to support Kaiser patients that are in communities that Alliance serves? Windsor, Healdsburg, Geyserville, and Cloverdale. I've personally registered as a trusted volunteer multiple Kaiser members at Alliance clinics due to the overwhelming number of seniors 65 and over in Kaiser and North County. I think you've answered it to some extent already, but
I think I did. I will say thank you for being one of our patient advisors. We really appreciate your contribution and participation to our care experience for all of our members. I think, you know, we'll continue to keep doing what we have been doing and serve our members, but also be ready and willing to serve as partners with the rest of the community.
Thank you. This is from Todd from Cloverdale. The message of stepping aside if you can work from home and mitigate your risk and allowing more frontline workers to access the vaccine is very compelling. Are the county and other institutions aligned with this message, and what can we do to promote this important message? I would go to Jenny on that.
Yeah, I mean, I think it's a hugely important moral question of our time, honestly. And I do think that the county is behind that, although I think it's difficult for them to actually say it. There's so much pressure right now on all the systems. Like all of my patients are calling me and sending me messages and asking. It's the same for everybody else on this call. And the county feels that as well. And so I really think, I mean, that the phrase that sticks in my head, you know, if you can mitigate your risks, wait, that came from a public health officer, right? In some of the conversations that had been having, but I think it's hard for them to stand up and actually say that. And I think we got to get better as a community to say the two things, say your turn will come, like, it's okay, just wait, we got you. And also just to say, if you can mitigate, wait, right? And so I think all of us need to get better at saying that and trying to kind of just like you're using the phrase like vaccine anxiety, kind of like that need to like want to get it now and just realize that like we're doing the best that we can, you know, and the time will come.
Thank you. Here's one that I'm not sure who should answer, but are there any data or anecdotal info on vaccine efficacy vis-a-vis long haul COVID illness? That's from Annika from Healdsburg. I don't know, Dr. Hammond, do you have any information on that?
In terms of long-term vaccine efficacy, you know, this is new. This is, we're still using emergency use authorization for these vaccines. And we don't have long-term data, long-term studies yet. We will. We absolutely will. And I think, you know, as a community, we're going to have to take this as it comes and wait for the science to tell us those answers.
Got it. Here's one in the vaccine anxiety category from Becky Daly. She says, we had our first vaccine with OptumServe. We are both 70. Now we can't register for our second shot. So my question is, where can we get our second shot that should be due on February 21st? The first dose was Pfizer. Anyone have advice for people who've gotten the first dose and weren't registered for a second dose at that time? I think earlier today in our conversation, Dr. Hammond, you said one thing Kaiser's learned is to register people for their second dose at the time of the first dose. So I think we have a little bit of a stutter start on that logistic. Anyone, maybe Sue, do you have any comments about what you guys are doing to make sure people are registering for a second dose, or what someone like Becky could do?
Well, it probably depends on who who Becky and her husband are connected with, as far as their health system or their provider, you know, and following up with them. For us, yeah, absolutely. We've learned that having that second appointment or that second visit scheduled is really important, and kind of that plan for follow-up, so people do know where they're going to get their second dose. I know, you know, at some of the sites we've been vaccinating, we've had people show up wanting their second dose and having gotten a different vaccine than what we're giving at the site and not having a plan. So really, I think it's that people need to follow up with whoever their PCP is and get instruction from their primary care provider to determine what the next step is for them.
But I would say, because they got the vaccine through Optum Serve, which is at a particular county site, right? That's contracted with the county. Again, I think that's part of the stutter step. And I think all of the systems are realizing that you need to have that second appointment. And so I think just because it's at the beginning, I'm assuming that they're going to reach out and figure that out with you, because they have to. It's like part of vaccine administration is they have to get that figured out. And so I think there's hope that you'll be able to get it figured out.
I will just add that the manufacturers send the second doses. So, you know, we receive first doses, we give them, and then the second doses come later. And the manufacturers are in charge of making that happen. So your second dose is arriving wherever you got your first dose.
Got it. That's very helpful. I hope that helps you, Becky.
And along the lines of the vaccine anxiety, I know one thing I've heard from people, they think they have to get that second dose on that exact day that it says on their card. It is okay if it's not on that exact day. So if they can't get an appointment back with OptumServe on the exact day, that is okay. They will still have the efficacy of the vaccine when they get that second dose.
Great. That's very helpful. Here's a question, I guess, for maybe for Michael and Jenny. What our audience is asking, several people are asking, what can they do to help? You know, probably a lot of people on this call right now do have the privilege of waiting if they aren't in the 75 or older or farm worker categories. What can they do to actually actively help? What would you suggest for them? Let's start with Michael and then Jenny.
Yeah, I mean, that's a great question. You know, I think that if you know, this whole idea of 6 degrees of separation, you know, I feel like for those of us who are boots on the ground, a lot of the people that have come and helped us have actively tried to get engaged with community efforts. And that's actively seeking for opportunities, whether it be, if we're talking about the northern Sonoma County area, organizations like, certainly there's the clinics, but Corazon Healdsburg and organizations like that are actively working in the community. If you've got some time to volunteer or you want to get involved, reach out to your local communities that are working in the community. And right now, I sure think that they would welcome an opportunity for a set of extra hands. They often are, organizations within the community are often connected to outreach efforts around food distribution, housing, economic welfare, mental health. And so I think a lot of the people that have been sort of looking for opportunities have gotten involved by just reaching into the community and even just calling these organizations, sending an email, asking around. You'll find pretty quickly there's a lot of opportunity to just attend an event. There's going to be an event this weekend in Sonoma County on Sunday. If there's time, we can talk about that. But there's ample opportunity to get involved, and certainly as much as you want to, or if you just once a month want to show up, we would welcome any of that.
Thank you. Jenny?
Yeah, what I would add to that is resource allocation, right? So say you have risk profiles, you don't want to leave the home, you don't have the ability to go out into the community. There's some phenomenal organizations. So Corazon Healdsburg is a good one. Mi Familia Sana is another one. I would say I've been doing a lot of really powerful work with local artists. So Raíces Collective from Santa Rosa, and they're the ones that are providing the art for a lot of the Sunday like art revealing of messaging to the Latinx community on Sunday. So Raíces Collective, and then seriously, like donations to UndocuFund and to the Redwood Empire Food Bank, because the devastation and the urgency that the community is experiencing on the ground is dire, and it's continuing. And so I would say resource allocation is a huge piece to that.
You just threw a softball to me to say also the Healthcare Foundation, because we are providing emergency funds this year, last year. We're about to release another $100,000 if you're interested in supporting emergency work for COVID in the areas of health access or mental health or food security. We're distributing funds as quickly as we can raise them. So we'll chat out the link to our website if you'd like more information or to get involved there. Shalene, were you trying to add to that?
There's another part of this too, is that students are really struggling with tech, and there are opportunities. I have a coworker who started a pilot project in Sonoma that helps students with tutoring and tech assistance, and I believe that it's now countywide. So there's tons of opportunity. You just have to look for it, and you can be at home, showing, explaining to kids on how to use their tech, or helping them make their Wi-Fi more, better. There are opportunities out there. So I totally agree. Jenny and Mike touched it, but there's tons. You just have to look for it.
Here's a question for those medical professionals who are really able to talk about, what about people when they get their vaccine? This is really in the category of vaccine hesitancy. What should they expect? We've heard lots about it. Now we've got much more data. Is there anything you'd like to tell people for when they get their vaccine, what to expect? What are you seeing? I go to Dr. Hammond and Jenny, and then Sue.
Sure. So we're seeing definitely sore arms, I would say, would be the number one side effect. Actually, add to that, the number one side effect is actually joy and just the tears of joy and excitement that people are receiving, but sore arms. And then with the first dose, somewhere between 20 to 40% of people have mild flu-like symptoms like achiness or low-grade fever or mild fatigue. And that seems to be just a little bit worse with the second dose. Interestingly, older populations seem to be a little bit more protected from those side effects. And many of us, myself included, sort of celebrate quietly that it's our body's immune system working well and reacting effectively to the vaccine. We have had a few vaccine reactions. We have not had any that have required emergency treatment, though it is important to be vaccinated that you do follow that 15-minute observation period. So that is still important and still part of the guidelines at this time.
Thank you. Sue, go ahead.
So I would say that, yeah, I mean, I echo the same as far as the most common side effects, but that's the kind of flipping the script and understanding that that's something to celebrate, that this is not that you are getting sick. The vaccine did not make you sick. Your healthy immune system is responding to the vaccine in the way that it's supposed to. And that's how you know that your immune system is responding, because you're experiencing these symptoms that are associated with a healthy, normal immune system response. So when I have patients or employees that are telling me, oh, after my vaccine, I felt this way, and it's a normal immune system response, had a little bit of a low-grade fever, felt tired, felt achy. I'm like, well, that's great. That means your immune system got the message, made the antibodies, and is responding to the vaccine. So you should celebrate that. And it really is a positive thing. And I think that makes a big difference in people understanding that this is a positive thing to have these symptoms.
Anything to add? Thank you, Sue. Anything to add, Jenny?
I think the only thing I would add is that I'm going to keep it real and say that, like, sometimes that very normal immune response can feel really bad. and it's normal and it's good because that's what it's supposed to do. And it's going to be likely more after the second one. And so that's going to, and it's self-limited. It's going to last 24 to 48 hours. And usually people are better after that. And so it's something that you can expect and kind of plan around.
Great. Well, we are getting close to the end of this hour. I would love to just have each of you give a final word of advice to people in our audience tonight. What you would like, I know you gave your initial message, but is there anything after the conversation that you'd like to share in brief before we go? So we'll do the same circle. Go ahead, Dr. Hammond.
I'll just share that the first COVID hat that I wore for Kaiser was something called COVID surveillance. So starting in April, myself and my colleagues were calling patients who had COVID and helping them cope through it, checking on them. It's really so exciting as a community to have this tool and to have this vaccine and to now be at a stage where we can do something, and we can do something really historical, really powerful, and something that can really restore our community back to where we want it to be. So I remain optimistic and really excited. It's not to say this isn't hard work and that it's not hard on every single one of us who have lost loved ones or are worried about loved ones or worried about when the vaccine is going to get into our bodies. But we can do this, and we just need to do it together.
Thank you. Jenny, we're going in the circle. There you go, Jenny.
Yeah, so I think I would like to end on something similar, right? I think that the vaccine has brought me hope for the first time in a really, really hard year. And then I just want to kind of go back to this idea of equity and what it means. And to me, equity means that we really think about protecting our most vulnerable and our most at risk. And that might mean stepping aside for a while, but I truly believe that the only way we're going to get out of the pandemic and get past it is if we focus on our most vulnerable and prioritize their health and well-being and their rights and all of that before everything else. Like, and if we prioritize that, I really believe that that's how we make change and that's how we get through it. And there's a lot of heart and hard work going into this right now. Everybody is trying really hard, and it's hard. We all want it. We all want our loved ones and our family members and our friends to be safe, and we want to shed those tears of joy for them as well. And I'm going to just reiterate, if you can mitigate your risks and stay home and work from home, you might want to just take a step back and allow other people, now when we have vaccine shortage, allow those with higher risk step in line and take their shot.
Thank you. Sue.
Yeah, I would just like to basically say that, you know, we're facing an opportunity for all of us to work together to ensure, you know, equitable and efficient distribution of vaccine. It's really important for people to understand that all of us involved in providing vaccine and setting up ways to do so will continue to vaccinate until every person who wants to receive a vaccine does. And that's not going to stop. So the idea of kind of waiting your turn will come. It's not going to stop there. Yes, it's scarce right now as far as the resources, and we need to prioritize, but manufacturers are going to continue to make it. We're going to continue to vaccinate, and everybody will get it. This community has absolutely inspired me as it's the way that it's responded to previous crisis. We're not new to crisis around here. I mean, we've dealt with wildfires and evacuations, and I've seen, you know, total strangers support each other in an amazing way and band together to get through adversity. We're facing another really big challenge and something that we've never faced before. But if we can do it together and work together to make sure that our neighbors get vaccinated, to make sure that we all have access to the vaccine in an equitable way, we can do absolutely amazing things and change history.
Thank you, Sue. Shalene.
I too am very optimistic, and I take pride in every day talking to people that are really, really afraid of the vaccine to get it, and if they are eligible. And we can do this together. We, just like Sue said, we are a very resilient a community that has gone through a lot. And the collaboratives, Jenny and me sit on many community partnerships together, and we are doing this together. And I am proud to be here and seeing the future, looking at the future, hopefully to be all of us be healthy and or not have to wear a mask and have COVID around as much. For my frontline workers, I'm excited. So thank you.
Thank you, Shalene. Last but not least, Michael.
Yeah, so Kim, I just want to thank you and the Healthcare Foundation for giving us this platform where we can, share this information, we can share our opinions, and hopefully the community who's listening can carry forth these messages that I think are really important and spread this information that is critical and vital. And I think my message, I could echo what everyone has said already. I would just only add that, as we move towards the solution of a vaccine, which is I'm just so incredibly thankful for, that we just also remain mindful that the suffering continues for so many, and that we're not out of the clear on that at all, and that we just hold a space for that as we continue to look forward and get folks vaccinated, that we just remain mindful that there's still a lot of need out there in the community. And so we're an incredibly resilient community, but we're not out of the woods yet. And so again, thank you so much, Kim and the Healthcare Foundation, all of you who are here tonight, and upward and onward.
Well, thank you. And thank you to all the panelists. Again, you're all on the front lines doing the work, making it possible for the rest of us to trust that the vaccine is going to do its work. So thank you so much for sharing your wisdom tonight. And thank you to everyone on the call. Thank you to all our supporters for joining us in educating ourselves, and all the volunteer work that you're doing, all the support you've given to the Healthcare Foundation to do our work. We can't do it without you, so we're very appreciative. If you would like to be more involved, we've chatted out our website address, healthcarefoundation.net. We have the emergency fund. You're welcome to help support that effort. There's also our 2020 impact report there if you'd like to see the work that we did last year. Onward and upward. We're so grateful to all of you. Thank you and have a great evening.